Hi, I'm Dr. Maria Trakas, and I'm a physical therapist.
Hi, I'm Dr. Susann Clothier, and I'm a chiropractor.
And we're both clinicians at Performance Spine and Sports Medicine. Today we're here to talk to you a little bit about sciatica. So what are the objectives of our talk? Essentially, we're going to talk about sciatica. We're going to define it for you. We'll discuss some common causes. We'll review the basic signs and symptoms, go over how a diagnosis is made, and then we'll talk a little bit about treatment options, both chiropractic and physical therapy. Some basic back facts. Essentially, 70% of individuals who have some back pain at any point in their lives, out of those, 25% will have symptoms of sciatica. The prevalence of a lumbar or low back disc herniation is between 1 to 5%, and the estimated annual costs in 2000 were $100 billion, and that is steadily increasing. So what is sciatica? Sciatica is not a diagnosis, but rather it's a set of symptoms. Essentially, it results from compression or irritation of either spinal nerve roots or the sciatic nerve. So essentially, when you hear the word sciatica, it pretty much just means that you have pain in the back of your leg, but the causes can be many.
So what is the sciatic nerve? The sciatic nerve is composed of the nerve roots from L4 to S3. The nerve roots run through the greater sciatic foramen of the pelvis, through the gluteal muscles, below the piriformis muscle. Once it passes the piriformis, it runs deep to the gluteus maximus, midway between the greater trochanter and ischial tuberosity. In some cases, the sciatic nerve actually pierces the piriformis muscle rather than passing above or below it.
So what are some common causes of sciatica? Disc herniations occur in about 90% of people, so it's the most common cause, closely followed by spinal stenosis, piriformis syndrome, pregnancy, and weight gain. Disc herniation, as I mentioned, is about 90% of sciatic cases. Essentially, the disc causes pressure on the lumbar or sacral nerve roots. There's swelling of the nerve and of the surrounding structures causing pain. Also, spinal stenosis. So that's basically a narrowing of the spinal canal, and that can be due to a variety of things ranging from bone spurs, inflammation, a herniated disc, and a spondylolisthesis, which is essentially the slippage of one vertebra on the other. Pregnancy and weight gain kind of fall into similar categories. They both result in excessive weight gain in the front of the abdomen, causing more pressure on the sciatic nerve, and tumors or trauma can also cause the same. Piriformis syndrome is another potential cause. It's fairly controversial. Some research says that it's very rare. Other cases indicate that there's about an 8% chance of developing it. It essentially results from a shortening or spasming of the piriformis muscle, secondary to trauma or overuse. They often call it the wallet sciatica, essentially from keeping a wallet in your back pocket and then sitting on that for long periods of time can inflame that piriformis muscle, causing pain. If your physician, your chiropractor, or physical therapist indicates that the nerve root is not the problem, then this is likely a potential cause.
So the piriformis muscle, it is clinically significant because of its proximity to the sciatic nerve. It may become inflamed and spastic and compress the sciatic nerve right in that area and cause the pain to go along the entire course of the nerve, originates from the sacrum and inserts into the greater trochanter to the femur, could cause particular pain right down that posterior thigh. And the gluteal muscles, they also have active myofascial trigger points all along them. That refers pain to the posterior thigh, which is really similar to a sciatic type pain. And the pain pattern is about L5S1 disc defect with a nerve root compression. So this is an example of what a trigger point may feel like if you have one. The bull sticking his horn right up in you. So signs and symptoms. Pain in the buttocks or leg, worse when sitting. Burning or tingling down the leg, weakness, numbness, or difficulty moving the leg or foot, constant pain on one side of the buttocks, and a shooting pain that makes it difficult to stand up with a straight leg. And how is sciatica diagnosed? Here at Performance Spine and Sports, we use a lot of orthopedic tests, provocative tests, whether you're a chiropractor or physical therapist. These are some of the examples of the tests that we may do to determine whether it's sciatica, herniated disc, stenosis, anything like that. We also do EMG, which is nerve testing, also X-ray and MRI for diagnosis. Treatment options, as far as chiropractic goes, is you would have an initial evaluation with a board-certified doctor of chiropractic. What this includes is both the full history of the patient and their family history, because that's very important. Review of systems, which is, urinary, digestive, respiratory, cardiovascular, everything like that. We do a review of previous imaging and testing, whether you had x-rays performed somewhere else, something like that. History of previous treatments, how have you tried to fix this before? Orthopedic and neurological testing, as well as a report of findings where I explain to you what your diagnosis is, what this means, that type of thing. There's also modalities that we use: heat, ice, electric stim. There's a hands-on manipulation, which is what chiropractors are known for. Instrument adjustment, if someone doesn't like to hear that popping, cracking type noise, there's instruments we can use that are very specific. We also do flexion and distraction, which is Cox technique, sacro-occipital technique, and spinal decompression, which helps just traction out that disc. Another set of treatments that we do is also Graston technique, active release technique, kinesiotaping or strapping, drop table, Webster technique for our pregnant patients, massage, and ergonomic retraining.
So what are some treatment options physical therapy-wise? As Dr. Susie mentioned, a thorough evaluation is conducted, this time by licensed physical therapists, and each patient comes out with an individualized treatment plan. As we discussed, the causes of sciatica are many, so you want to make sure that you're being treated for the right thing. In the early stages, we really try to manage your symptoms, so essentially we'll use different modalities, ice or heat as appropriate. Some patients find benefit in TENS or electric stimulation. Myofascial release, massage techniques, we'll do some gentle stretching if appropriate. We do follow some direction-specific exercises, so for instance, usually people with herniated discs will typically benefit from more backward bending type activities. And then we also use taping, either rock tape, kinesio tape, or leukotape as a postural reminder and to help with pain. So as the pain gets better, we'll gradually progress exercises. Oftentimes we find that people with back pain have a deficient core or hip musculature, so they benefit from strengthening of those areas. Eventually we want to work toward a return to work and/or recreation. So we'll make suggestions for how to set up your workstation, teach you how to bend and lift properly so that when you do go back to work or your recreation that you don't re-injure yourself. We'll give some suggestions for return to gym, and also equipment recommendations, lumbar rolls and things like that. Tips to prevent recurrence of your back pain, and also a home exercise program so that you can continue the gains that you make in therapy. So in conclusion, sciatica is not a diagnosis, but rather a set of symptoms. So it's super important that you get an accurate diagnosis in order to ensure a full recovery, and chiropractic and physical therapy care is beneficial in all stages of the recovery process. Some frequently asked questions in terms of sciatica. One of the common ones is, will my sciatica come back? And essentially what we say is that treating your back pain is almost like how you treat your teeth. So you brush and floss proactively so that you keep a healthy mouth and gums, and that's pretty much the same thing for sciatica. So if you want to keep your sciatic symptoms away, it's important that you continue with your exercise in order to keep that from coming back.
Another common question is, do I need to see physical therapy and chiropractic for the rest of my life? The answer to that is no, but it's kind of an extended answer for this one. Physical therapy is when you come for acute type care. You get the exercises you need. When they feel like you're ready to go home and have your at-home care program, they'll release you and you keep going doing your at-home exercises to prevent that type of thing from happening again. Chiropractic, same thing. My main goal is always to get you about 50% better, and then from there another 50% better, another 50% better, so on and so forth. A great thing about chiropractic is also maintenance care. Just like the brushing your teeth example, you want to make sure your spine is moving and everything, all the joints are moving correctly, that you prevent this from happening again. So a little maintenance care doesn't hurt, just like brushing your teeth every day.
One of the other most common is, can I return to the gym after an episode of sciatica? So the short answer is yes. Usually what we like to do is simulate your exercise activities either in the gym if possible, or have you return back to your workouts and then let us know how you're feeling. So we try to recreate exercises that mimic the type of activity you're trying to return back to. Essentially, we don't suggest that people go back to their routine if they're having pain on a daily basis. So we want to certainly get you out of the acute pain, and definitely with the goal of getting you back to your exercise pain-free.
And the final question is, should I do physical therapy and chiropractic at the same time? We found that we get amazing results when we do physical therapy and chiropractic in the same visit. Physical therapy can work on function of the muscles, of the joints, everything like that. And then chiropractic, we work on the structure to make sure everything structurally is where it should be and that the joint is moving correctly. So it's a great combination if you can do it.
We thank you very much.
Thank you. If you have any questions, feel free to contact us.